for the knee. All right, first test.
The patellar apprehension test.
Patellar apprehension test. So, looking here, and I'm gonna push medially on it and seeing if his quad activates or if his body starts guarding. And if it does that, it means there was a subluxation of the patella medially, but since I'm able to push his finally and he's not activating his quads, he's fine. That's the negative side. Next test.
The Ballotable patella or patella tap test.
Ballotable patella. I'm going to squeeze together his patella like this. It's also called floating patella. I'm going to push down and see if the patella floats up and down and bounces back towards me, which it does not. So he does not have any intercapsular fluid.
The sweep test. Wipe, brush, bulge, or stroke test.
The sweep test, testing the same thing, testing the intercapsular fluid. So I'm going to sweep up all the fluid up here, and then I'm going to push over and slide and see if that fluid shifts down and around, or if the patella moves, which it did not. So that's a negative sign.
The Q angle test.
So the Q angle test, I don't have a goniometry to show the test, but I can explain it. So the fulcrum of the goniometer would be on the patella, the stationary arm towards the ASIS, the fulcrum, not the fulcrum, the movement arm to the tibia, and you're measuring to see the carry angle of the knee. It's a positive sign for like a large Q angle if it's 13 degrees in female and 18 in male, and if you have a large Q angle, that can predispose you to multiple injuries.
The bounce home test.
Bounce home test, we're testing that patella and we're testing the knee, so we're just bouncing it like that, seeing if the leg locks and bounces back up.
The patellar grind test.
So the grind test is comes to the table. Okay, I'm going to find his patella like that, stick my hand like that, and you're going to extend your knee, and flex, there you go, yeah. And I'm feeling for any grinding or cranking in there, proving osteochondritis of the knee.
The Godfrey 90-90 test.
Godfrey 90-90. You're sitting your back. I'm gonna lift both these legs up and bend the knees. And I'm looking to see if the tibia drops posteriorly, and if it does, it's a positive for a torn PCL, but his does not. And for that also, you can do the quad activation test. So, if I have them like that, a 90-90, and when I bring him back here, I can also see the PCL dropping. I can have him activate his quads, so flex your quads. And that tibia should move anteriorly, also proving that he's a torn PCL.
The reverse pivot shift or Jacob test.
Reverse pivot shift. So you're in and you're pushing out. Pushing out while moving the knee in. So I'm pushing like that. And I'm pushing out, putting theirs.
Anterior Lockman's test.
Anterior Lockman. Come around, grab the leg. Testing for the ACL, see if it's torn. Have it. Like such. Okay.
Anterior drawer test.
Anterior drawer test. So Taylor, I'm going to scoot back a little bit. Okay, push your leg up. No, that's it, flat. Bend your knee. Bend your knee, kid. Come like this. I'm also testing the ACL and pushing down. See if the leg goes back.
Slocum test with internal tibial rotation.
Internal rotation. This, I'm testing the LCL and all the lateral structures along with the ACL. And then the next test is the same but with external rotation. And with that one, testing the medial crowd ligament and the ACL and all the medial structures as well.
Pivot shift test.
Pivot shift test. This one, I'm pushing in and I'm flexing the knee.
The jerk test.
Jerk test. So I'm going to internally rotate that and then push in and come out. And put it back up. Come back down. Also testing that MCL and medial structures.
Posterior drawer test.
Posterior drawer test. Come out in here, and we're pushing down on that. Testing for PCL.
Houston posterior medial drawer test.
Okay, for that, I'm going to externally rotate the tibia here, pushing down, testing all the medial structures, the MCL and the PCL.
The Houston posterior lateral drawer test.
Okay, for this, testing the LCL, the PCL, and all those structures there.
Posterior Lockman's test.
Posterior Lockman's. I am, well actually, having it similar to a Lockman's, as you can see here. And instead of pulling towards me, I am pushing down. Like such.
The external rotation recurvatum test.
So the external rotation recurvatum test, I'm here, I'm pulling up, seeing if he needs recurvatum in his knees, which he does not.
The valgus stress test.
So the valgus stress test, pushing in as such, like that, testing the MCL.
The varus stress test.
So there, stress test, we're doing the opposite, but this time we're testing the LCL.
The McMurray test.
So McMurray, we come here, palpate that the joint line, and then I'm externally rotating to come up, internally rotating to come down. I'm testing for meniscal tears.
The Apley compression test.
So heavy laying your stomach. Okay, and this one you can also do the Apley compression distraction. So come here and I'm pushing down, trying to feel for any meniscus. So I'm pushing that, and if they have pain, they should not have pain when I do distraction.
The Thessaly test.
Thessaly's test. Have you stand up real quick for me? Go ahead, face over here. Face towards me. Okay, stick your arm out. Go like this, press your arm like that. Okay, stand on one leg and bend it a little bit, and then twist. And then this, we're testing for ligament sprains and then meniscal tears.
Ober's test.
So I have it laying side on the table, facing the wall for me. We can test IT band. So actually, scoot back towards me real quick. Butt on the edge of the table. Actually, get back, wind up like that. Sweet. Come back out here like this. Move my knee out, supporting the hip. Let the knee drop. And since his drops below his line and kind of off the table, that means his IT band is not tight. But if it stayed level or raised, it would be he would have a tight IT band.
The Lilly test for anterior cruciate
So Lily's test. So maybe sit.
injuries.
Sit for me. No. Using this way. The exhale. Okay. That's done. Okay. And I'm going to hand here, just in your ACL, and as I push, his leg and his foot should hop like that, showing his ACL is intact. But if I were doing this and his foot did not jolt like that, it means he would have a torn ACL.